So, I had chemotherapy yesterday, and today I meant to inject myself with this little thing here called Neulasta, which is meant to promote white blood cell counts as they can be quite damaged during the process of the chemotherapy. What do we have here? Alright, so first of all, I don't know for sure all the things I'm talking about. This is just my understanding, and as short-term memory can go a bit during this whole process, well, really, would you trust me? But hopefully it'll give you a bit of an idea, an overview, perhaps some questions you might want to ask for your doctor. First thing is, obviously I'm going to have to inject it. Now, where am I going to inject it? I'm going to do it into my stomach. This is because it is large enough that I cannot miss. The surgery that I had was on the lower right, essentially where just above where the stomach and the legs join. So because it's on the right hand side, I'm going to be using the left hand side of my stomach to keep away from that, keep it nice and simple. I want to make sure that the side that had surgery done on it, where it's still a little sore, does not hide any discomfort and problems with the other side. Right, so first thing is sterilising. Here's my table that I'm going to work on. Now, this table I actually wiped with alcohol. I have washed my hands with soap and water, and then used a little bit of hand sanitizer as well, just because why not? I just used any old generic brand. Pretty sure it's all alcohol or something along those lines. I have wipes ready in case I need anything else. I have here, for sterilising, the actual spot where I'm going to do it, some swabs that they came from the hospital, but I know you can buy them from a chemist. And that is just about it. Now, when it comes to instructions, I'm not going to have problems because set of instructions 1, set of instructions 2, and I'm not sure if this is a vision thing, but now we also have set of instructions 3. I have as well my own hand-taken notes from the time at the hospital, except they're not very good, so I'll just have to go off from memory. I also did a bit of looking on YouTube myself to find a couple of other videos, and those videos sort of gave me a few little things to be aware of. So, what else do we need? Sharps container. Now, being here in Australia, I was very lucky that the hospital just gave me one of these sharps containers, so I can put the needle directly into the end, close it off, and I talk to my chemist. I can take this then to the chemist and they will dispose of it properly. If you do that with the chemist, you need to make sure that you do have a proper authorized container. I believe you can buy these if you need to. Oh, and I didn't have cotton wool for after the injection to hold it, so I got a bit of kitchen paper, and what did I do? I rubbed it with the hand sanitizer in the vague hope that that will make it somehow sterile. What other things do I need? I've got the plasters, or we call them band-aids often in Australia, for after the injection. Didn't come from the hospital, so do make sure you have some ready. Oh, this is the one that I did get from the hospital just when I had the surgery to remove the cancer. Too big. Important step. Apparently it can be quite unpleasant if you inject yourself with something cold. So this has now been out of the fridge for about half an hour to give it time to warm up. It needs to be kept cool if it's going to be stored for long periods of time, within 24 hours. Apparently room temperature is okay, but this is Australia, so room temperature is probably hot enough to boil an egg. Now we get to the pointy end of things. Right, let's take off the packaging. There's a little arrow. Now at this point I feel I'm running out of time to avoid this, but there we go. Out it comes. Now, if we have a look there, there's a little window that allows us to see the material, and I can see the label on the other side with the writing, so I assume that means it's not cloudy. If it's cloudy or any of this is damaged, you're meant to get rid of it and call your doctor. There's also, I believe, a date that shows the expiry and the batch number. There's a sticker there that you can take off and store later on. We'll have to see. At the moment, it's all covered. Now, the important thing is not to take off the needle cover until you're absolutely ready to put it in. So, when you do that, if we're going to do this, we should actually read the instructions. Oh, something else you have to be careful of in case there are any air bubbles. Now, at the very bottom of this, I don't know if it's going to show up on camera, we'll see. It looks like there is a tiny little air bubble. So, I'm going to flick the little, then start to wonder, is that an air bubble or is that? Now, there it is, there it goes. And we're meant to flick them just so they go all the way up to the top. You'd think they would have good anti-air bubble technology by now. Now I'm assuming that tiny little air bubbles will not kill me, or this video is not going to look very good. Okay, so I think that is about it. There's an absolutely tiny one there. Oh, there's the big air bubble. Alright, I've gotten rid of it down to the point where there's one tiny little micro little spot in there that's an air bubble. The larger ones are cleared up and they're all up in here. So I understand that I can squirt out a tiny little bit of that just to get the air out. Now, step 2, according to our instructions, we have got our little container here. When we hold this, we don't hold it by the needle, we hold it by the sides. That's when we do this, so it tells me. We take off the top. I will give it just a little bit of a push to see if we can get those air bubbles out. Now, then the hard bit, you've got to push it in. Thing to do is to pinch the skin tight together. If you know someone who's a diabetic, I imagine they would be good at doing this. The reason why is it makes it a firm point, and if you were skinnier than I am, it would stop it from risking going further in than you want it to, as well as it is, quite frankly, I have a mountain of fat that will be a safety barrier. Now, you have to then push in with the needle. The suggestion that I've seen is once the needle is in, first of all, probably doing it quick is better than taking a long time. A little bit of pain, not much is the impression I've heard, it's a small needle. What I can do is pinch, push it in, and then with the hand that was holding the pinched skin, you can then use that one to hold it and the other one to press in. I think some of that just comes down to whether or not you really need to keep that pinch going while you're injecting. I might just try that anyway because I think it's all going to hold in place. Then once that's injected in, when you're pushing in, it should make a snapping sound or feeling. We'll find out as we go. And you can't just finish it with that snapping sound. You've got to just push and let it go. It says all the way through the snap. Now, what that actually means, I have no idea, but I assume it means at the first hint of sound, we can't stop. We do need to keep on pushing it in. All right, so it's pushed in. Then, once it's fully done, we're going to just pull it out. So, once that's out, what are we going to do? We'll just put a little bit of paper over the top just to stop any extra bleeding. Cotton wool, if you actually have some. This goes straight into the sharps with one exception. I am going to make sure that I remember to take off the sticky label that will have details about the batch number in case it turns out to be horrible toxic or something along those lines. Then Band-Aid. This is it into the sharps. Band-Aid. You do not put the cap back on because if you have a sharps container you don't need to. There's no point unnecessarily pricking yourself with the needle. So straight in it goes and then Band-Aid's on and you're done. Let's see if this works. Okay, so been holding this upright because we do need to make sure we keep those air bubbles out. Now, what I need to do, I need to make sure that I keep the spot where I'm going to put the needle sterilized. So you, I'm afraid, have to stare at my stomach while I take off the swab. You do need to let the swab dry. Well, no, you don't need to let the swab dry. You do need to let the skin dry, apparently. So, the bigger the area you do, the less the chance that you're going to miss the area. So, I'm going all over here because, quite frankly, I have a big stomach. Now, I've got the needle here. I'm sure it's going to dry very quickly. I'm going to take off the top. If it lets me. Let's feel this. There it goes. There's the top. The needle has a tiny little bit of liquid just around the edges. I'm just going to squeeze up. There we go. And we got rid of those air bubbles. I don't know if you saw that. Now, those air bubbles gone. We can put this on the side. I need to grip it strongly. Now, I have got it so that the area, as I said, wound was over here from surgery. Don't do it right near the belly button. I believe that may be that there are extra blood vessels and things like that there. Where I am going to do, I'm not going to touch with my fingers because I do not want to get any extra germs in there. And alright, so now I just have to squeeze tight, and here goes, pushing it in, pushing it in. You know what? I can't feel that. Really can't. So that's a really positive thing. I barely felt anything. Now, people were talking before about making sure that you didn't have blood coming, like pulling back a little bit. I definitely do not not see any blood there, so I think I'm okay. I'm going to push it in. Alright, so I'm pushing it in, not doing it really fast. I've heard that this one is fairly thick, so some people find pushing in fast uncomfortable. There's just a little tiny bit of steam as it goes in. Not really that unpleasant. If you've had chemo, you've certainly had worse in terms of needles. I just felt a little bit of a snap then. And I think now that's about as done as it's going to be, and that's me using a fair bit of force. And once it's done that, it has auto-retracted the needle. Oh, some of the liquid came out on the skin. That should be right. It's automatically retracted the needle to keep that safe for the moment. But I am going to put it down and use my theoretically disinfected bit of paper there just to hold that in. Now, I'm going to need to do the band-aid as well. This is probably where it pays to actually have someone else, but when you're by yourself, what do? I don't see any blood coming, and quite frankly, I'm wondering if I'm even going to be able to see where the needle point was. I know that light's getting this a little bit hard to see, but if I look around, I really can't see it. So, there it is. Alright, that's really not a big deal. Very, very happy with that. And so here it goes. I think the bit that's going to hurt most about all of this, quite frankly, is taking it off. You see, I've even lost that pointy, and there it is. Get a free waxing at the end. Okay. Down, you don't have to look at my stomach anymore. So what do we do to finish this off? Again, covered needle, brilliant. There's a little label here. I'll bring that in close. Better see a little green label. I'm going to use that to peel off. There we go. And that gives us details about the dose and its expiry date. A couple of years safe. I think we'll be fine. Sharps container. Straight in, bit of force. And once that's in, then I'll just twist the top. And it's all done. That's it, closed off. So that can go to the chemist. Now, there are a possible set of side effects that can come with using the Neulasta. For me, the one that I was most aware of just reading up is the bone pain. Apparently for some people it's quite a lot, others it's not much, if anything at all. That's human diversity for you. The two possibilities that I've seen just to support that, Claritine is the brand name for one. The American version of that is Claritin, and it is, I will look up my notes here, they work by counteracting the effects of histamines that are released when the white blood cells are produced. The other one is just a pain relief, an ibuprofen one. In Australia, Nurofen is the most common brand, but there are plenty out there. That's meant to be pretty good as well for managing some of the pain. Effects may vary, obviously, depending on who. Definitely talk to your doctor. I talked to my pharmacist, actually, checking to make sure that there were no problems with interactions between the various drugs that I've had as a result of the chemotherapy. There we go. It actually really doesn't hurt much at all. I wish I'd realised beforehand just how little it didn't hurt. It's a bit weird putting a needle in, but honestly, it is so fast and the thing is so sharp that it just doesn't really matter. So I'd say don't stress over it. Just make sure you've got your stuff ready. If you've got someone there just to help with the managing the stuff, that might be good. But if you have to do it by yourself, yeah, no big deal. Best of luck. I hope if you're needing this that you will be improving shortly. Thank you.